Speaking from experience, when I do these with my patients myself, but the scan won't save you. It'll help. It's July, and everybody's literally trying to look inside themselves. This is the executive vitals. A Swedish company called Nekl just announced that they're going to be expanding to the United States. Full preventative body scans, blood panels, cardiovascular risk markers. 15 minutes in the clinic, and you walk out with a report. The company has a wait list in every major city, and people are excited. And I just want to explain why the excitement is only half the story. Listen, Nekl Health started in Sweden in 2022. It was co-founded by one of the Spotify founders, which tells you something about the design sensibility. The clinics are minimal, the tech is real. They scan your heart, they measure your arterial stiffness, run blood work, check your body composition. They do it fast, and they do it in a setting that doesn't feel like a hospital. Sounds familiar? We can white coat plug. That is genuinely useful. I want to be clear about that. Early detection works. I do the same thing. Data is better than no data, and most Americans have never had a cardiovascular risk panel done before something actually goes wrong. Go figure. Neko is solving a real access problem. I love that. But here's the data that gets glossed over in every tech review and health media article about this company. The scan is not the product, the interpretation is. In comes why you actually need a clinic. You can come out of the Neko clinic with a 40-page report and an arterial stiffness reading and a CIMT score. That's the carotid intima media thickness, which measures early plaque buildup in your arteries, and still have no idea what to do with any of it because the report gives you numbers. It does not give you context for your age, your family history, your stress load, your sleep patterns, or the other 6 letters you haven't run yet. I see this constantly in clinical practice. Someone comes in with results from a direct to consumer health platform. They spent real money on this. They have real data, and they're asking me, is this number bad? Because nobody told them. The scan gives you a signal. What you do if that signal requires clinical judgment. Those are two different things, and the industry keeps selling the first one as if it automatically delivers the second. Now, today's executive protocol is directly related to this because if you're going to invest in any preventative health data, one of the highest yield things that you can do is a VO2 max test. Not the estimate your Apple Watch gives you, not the algorithm Garmin runs while you sleep. An actual graded exercise test with metabolic gas analysis, the kind done in a sports medicine clinic or a exercise physiology lab. VO2 max is your maximal oxygen uptake. It's the single strongest predictor of all cause mortality we have in research literature. In a JAMA study that looked over 122,000 patients and found that low cardiorespiratory fitness carried a higher mortality risk than smoking, diabetes, hypertension. I want you to let this stand for a second as I move into the next topic. Almost no executive I've seen has had this test done. They've had cholesterol panels, they've had annual physicals. Some of them have worn a Whoop band for about 2 years, but the actual measurements that most predicts whether they'll be alive and function on 75, it's not done. A real VO2 max test costs somewhere between $150 and $400, depending on where you get it. It takes about 30 minutes. You wear a mask, you run or bike at an increasing intensity until you can't anymore. The results give you a number, your VO2 max in mLs slash kilograms slash minutes that you can track over time, and that actually tells you where you actually stand relative to the age match norms. Here's how to find one. Look for sports medicine clinics affiliated with university health systems. Some high end gyms with performance training programs have metabolic testing. Functional medicine practitioners sometimes offer it. Neko, interestingly enough, does not currently offer VO2 max testing. Another gap in what a scanning clinic gives you. If you're considering a Neko scan or any similar preventative health platform, I'm not telling you not to do it. I'm telling you to pair it with a clinician who can sit with you and actually interpret the numbers and what it means in context of your life. The scan is a starting point, not a destination. I work with a small cohort of executives doing exactly this, not just collecting data, but building a care structure around it. If that's something you want to know more about, I'll put information in the description. Nothing to sign, nothing to do today. Just check it out.